Hi, I'm Diana Doe, and I'm working here at Stanford alongside Shannon and all the great people who have participated in this conference. And this is a very exciting session where we're going to look at imaging and some of the complications that can occur with optic dystrusin, and then discuss later on, possible therapies that might be instigated. Wonderful. I think we'll go with our first session speaker today, and it's our director of this Optic Dystrusin Center, Dr. Joyce Liao, who will be discussing multispectral imaging of optic dystrusin.
Thank you, Diana and Shannon. There you go, the slide's advancing. I have no financial disclosures. At the end of this talk, you will understand how we image optic dystrusin and what the findings are. In the last century, we've been imaging optic dystrusin using color photographs of the optic nerve, including autofluorescence imaging, which is in the middle. Finally, ultrasound it used to be the standard of care for imaging optic dystrusin. In 2020, we now use optical coherence tomography. So according to the Optic Dystrusin Studies International Consortium, enhanced depth OCT is the best way currently to non-invasively characterize optic dystrusin. So what I've shown you here is an example of optic dystrusin in one eye, which is on the top panel, and then normal eye on the other side. And I've shown images from two different enhanced depth OCT systems. So system 1 on the left, system 2 on the right. So for optic dystrusin, what you see are this raised appearance comparing the top to the bottom, which has a normal contour. And there is a large druze that's buried on the bottom that you could see from both systems. There's also something called FOMS, peripapular hyperreflective ovoid mass-like structure that Dr. Hammond talked about this morning. This is thought to be from lateral bulging of the retinal ganglion cell axons and can occur in conditions other than optic dystrusin. And FOMS are not drusen and they're not calcified. So that's one of the questions that you'll see later on. In addition, there is something called hyperreflective lines that are often quite numerous and embedded within the unmyelinated portion of the optic nerve. And we've talked about this in the morning as well. So this is an example of bilateral optic dystrusin in a 23-year-old woman. The upper left picture is what a normal optic nerve should look like. And this patient, despite having 20/20 vision in both eyes, this is what her optic nerves look like. So there's a full lumpy, bumpy appearance in both of them. And I have arrows pointing to some sort of texture that you could see in the optic nerve. This patient's OCT measurement for retinal nerve fiber layer showed that there's some thinning in the superior portion of the optic nerve. There's also some thinning in the macular ganglion cell complex, despite the fact that visual field is basically normal in both eyes. Here is different imaging modalities for optic dystrusin. So the color photo, so the right eye is on the top and left eye is on the bottom from the same patient. In the second column, this is green autofluorescence. And you can see that there's a lot of bright spots. So all the bright areas are basically drusins. And what you see is just a few texture on the color photo, but on the green autofluorescence, you see that the whole nerve is full of drusen. In blue autofluorescence, you see fewer areas that are affected, but you see areas that are quite punctate and distinct. On infrared imaging, you see that the entire optic nerve in the right eye on top looks like it's raised, and you can see this contour as well as a darker ring of shadow that is nicely illustrated on the bottom. So here is just a way to lined up the different aspects of the color photo, the green autofluorescence and the blue autofluorescence. And if we do a slice, a line scan through the optic nerve in a diagonal fashion, the drusen in that superior nasal area in the left eye has a corresponding area in the right lower OCT image. So another imaging modality we're using to image optic Destrucin is OCT angiography. So this is quite new in the last few years, and we can now image at capillary level in micron resolution. All the fine vessels are within our retina and around the optic nerve. So this is the patient's color fundus photo on top versus the OCT angiography on the bottom. And so I was pretty astonished when this technology first came out at how much we can see with the OCT angiography, or how much we were not seeing with regular color photo. Here is a single image of the left eye side to side. And then what we do is we take these OCT angiography images and look for any kind of areas of defects. So this angiography is a functional measurement. It depends on blood flow. And so when I look at this picture, I wonder sort of on the nasal superior portion of the area, it seems like there are just fewer blood vessels there. And that seems to correspond with the green autofluorescence image, where you are in this particular nerve loaded with drusen in the superior and nasal area. And in a way corresponds very nicely with the thinning of the OCT. If you look at some areas that seem to be absent of flow, like the red area, this patient had fluorescein angiography. This is an early phase image looking at the same area at 26 seconds versus a later image at 5 minutes. And you could see that you really can't see any kind of defect using fluorescein angiography. So we think that OCT angiography is not only high resolution, but it could potentially look at perfusion defects that are invisible with fluorescein angiography, which has been discussed and shown in other conditions like diabetic retinopathy. Using an algorithm that's developed by Ricky Wang's lab at University of Washington, we're analyzing these pictures. And so let me show you what this looks like. We would do a threshold image. And then from there, we could generate a variety of different measurements, including looking at the density of the blood vessels. And so what I see is there is a hint that the left and left upper portion of the picture has fewer blood vessel markings. And we could generate a map of the vessel density. And so, however, when we looked at this, it's curious that the superior area, which had a significant amount of thinning on the OCT nerve fiber layer analysis, there wasn't the same kind of flow void in that area that I might have expected. So why is there this discrepancy between the two? So we wonder, well, maybe is it because, look at all those very large blood vessels, they're carrying blood away from the optic nerve to supply the rest of the retina, but it is not actually contributing to local perfusion, and maybe that's part of the artifact of the analysis. So we work with Ricky's group to remove these large vessels. So let me show you what these analyses look like. We would basically do the same thresholding and remove these large vessels. And we do an annulus analysis to generate a colorful heat map looking at these maps. And then we could calculate percentage based on the measurement compared to age-matched controls, and then be able to compare. So indeed, we do see that the superior quadrant of the OCT analysis does show an expected decrease once we remove the large vessel artifact. So if you compare side by side, the decrease is still not as profound as the thinning on the retinal nerve fiber layer. And there could be some interesting comparisons by doing a side-by-side and more detailed analysis in the future. So in that case that I just presented is one of the examples that we just published recently in American Journal of Ophthalmology. It's in the red box there. So this is a patient who have normal visual field and some decrease in the vessel density in the left portion of the ring that you see there. And what you do is when you compare across patients with and without vision loss, what you notice is that there is this gradual decrease in the heat map of the density, so that those with greater visual field defect have worse vessel area density, among other measurements. We did a principal component analysis to look at all the measurements and found that there were 5 key measurements that seem to correlate with visual field loss, specifically the thinning of the retinal nerve fiber layer, ganglion cell complex, and decreased density around the optic nerve. Interestingly, an increase in the macular vessel diameter and increase in blood flow to the macular area, so away from the optic disc, but greater, perhaps overall in the retina elsewhere, seems to correlate with vision loss. And so with the hierarchical cluster analysis, we see that patients segregate into 3 groups. The controls and people with no vision loss are in the middle group. And the ones with mild vision loss are in the bottom group, where they just have increased blood flow to the macula, but not thinning in the retinal nerve fiber layer yet. And then the last group who have the most vision loss have lost the thickness of the optic nerve. So I want to show more pretty pictures of the images. Basically, there are some examples of side-by-side color imaging, green autofluorescence, blue, and then infrared. What you see are these punctate appearing protrusions on the optic disc itself. Here's another example of a case. You see these very bright spots, and that is easily seen on all the different modalities that are shown here. And this is a patient who have no visual field loss. This is another patient who have a lot of vision loss, and you can see that the entire optic nerve head is full of autofluorescing drusen. That's also imaged on the infrared on top right. Finally, this is a patient with particularly severe vision loss, and on the infrared imaging, you see all these pretty little spots. And Dr. Yan, who led the group for this project, calls it the pearl sign. And we think these are superficial drusen that is well understood histologically. And so the picture on the right is a pathological picture from William Spencer at the Edward Jackson Memorial Lecture on optic disc drusen back in 1970. Well, this is published in 1978. And basically these are concretions, you know, that's very superficial, and you could see that very, very nicely on the eye imaging. So to summarize, on multispectral imaging, enhanced depth OCT is the best way to detect and quantify drusen. It could be done non-invasively and really fast in just minutes. Visual field loss in optic disc drusen is associated with a variety of measurements, including increased macular vessel diameter and flux, and decrease retinal nerve fiber layer, ganglion cell complex, and the vessel density. OCT angiography may be better than fluorescein angiography to approximate peripapillary blood flow. Obviously, a lot more research is needed on that, but we're encouraged that a non-invasive method could be the first line of choice to look at blood vessels in this condition. Green autofluorescence seemed the best to detect the largest amount of optic disc drusen. Blue detects a subset of drusen, but sometimes they're very bright. infrared imaging is widely available on all the OCT machines and other machines. And it actually shows very nice optic disc topography, much better than a color photo. And so we're coining the word, the pearl sign of optic dystrusin. I want to thank everybody who contributed to this work, and I'd be happy to take some questions.
Great, thank you, Joyce. That was fabulous. One of the questions comes from Andrew Carey and says, wants to know what instrument you are using to do the green autofluorescence. It says, does green autofluorescence mean you are using a green wavelength for excitation rather than blue used in short wavelength? Are you still using a green filter to measure the fluorescence?
A good question. So I was purposely trying to filter out all commercial influence, but you know, as long as I talk about all the machines, I think it's okay. The green fluorescence is done using the Optical machine. It actually has all three. It has green, blue, and red wavelengths, but the filter set it allows the excitation and emission to be in the green spectrum. The Heidelberg machine, Spectralis, is the one that we're using for blue autofluorescence, and it similarly has multiple color lasers, both for excitation and emission. The filter set is specifically set so that the it's detecting the blue length. We're hoping to do some development from an instrumentation standpoint so that we're able to do human better multispectral imaging, potentially with adaptive optics that you'll hear about from Alf Dubra.
Thanks. We probably have one more time for one more question. Jesse Gale says that the vessels drop out in glaucoma with thinning of the RNFL. So the vessels and the RNFL both kind of go out together. But in glaucoma, it doesn't add any conceptual information to the RNFL. Does OCTA tell you something different to the RNFL in optic dystrusin?
For optic dystrusin, I think because the mechanism is different from that of glaucoma, even though there may be some overlap, I think there is a real question about ischemia and blood supply in a more prominent sense. And so I think in optic dystrusin, the vascular imaging will be particularly revealing and important, especially since the most common cause of sudden vision loss in optic dystrusin is ischemic optic neuropathy. And so I think we need more studies to better understand what are the features, but the idea is that we can use non-invasive imaging to tell us who is gonna give who has no issues and will probably never lose vision versus those who may lose vision. And it's important to be able to diagnose ahead of time or at least, be able to risk stratify when patients have any symptoms.
Great, I think we have one more question, a quick one from Eric Geyer. What do you think the increased macular vessel diameter represents?
Thank you, Eric. I think, so first of all, I actually don't know, but the idea is that it's a compensatory mechanism. So if there is compression at the optic nerve head by optic dystrusin, that there is a relative ischemia to the inner retinal area of the retina, and that triggers an compensatory response to vasodilate, and that's why there's actually increase in the blood vessel diameter and flow. To our knowledge, this is not very well studied. I haven't seen it described in other conditions, but I don't think it's unique to optic dystrusin. I think it's potentially something that happens with all optic neuropathies that involve the optic nerve head, especially